Headquarters for the prevention and control of COVID-19. We are organizing the 129th press conference to deliver to you the latest information and take your questions.
6月11日0时至6月21日24时，北京累计报告本地确诊病例236例，在院236例，尚在观察的无症状感染者22例，无新增报告境外输入新冠肺炎确诊病例、疑似病例和无症状感染者，在院1例。昨日新增本地新冠肺炎确诊病例总数有所下降，北京成功在最短时间摸清了疫情传播的底数和重要风险点，遏制了疫情蔓延的势头，向好发展态势清晰。但我们仍要清醒地看到，首都疫情防控形势依然严峻复杂。要进一步压实四方责任，动员社会各方力量
and seek the critical points for the prevention and control so that we can maximize our efforts to contain the further spread of the COVID-19. We have to find every possible clue to facilitate the comprehensive containment of the virus. For the major areas, for example, the agro-product markets and restaurants, catering areas, as well as the communities and hospitals, those are the key areas and critical points for the prevention and control of COVID-19. We have to pay extreme attention to those critical points and never let go of any smallest detail and possible risk. Agro-product market is one of the key areas. We have to strengthen the whole chain of management so that we can secure the food safety for the people and offer the good quality food for our customers. Market entities should shoulder their responsibility, continued with the efforts of the disinfection and personal protective measures. For the cold chain products, we have to continue with the check and quarantine measures and upgrade the market practices. For the communities and local residents, local workers and officials should never let down their bar and also extend the prevention and control measures to reach every entity of the market, including the catering sectors of the work units and the restaurants, etc. We also have to strengthen the market supply and stabilize the product pricing. Nucleic acid tests constitute an important part of the precise containment of the virus. We have to guarantee and upgrade our capacity of nucleic acid tests. We have to race against the clock so that we can better test people in a more effective way. We have to assist those testing agencies and institutions, have a better organizational capacity, have an online platform for an appointment so that people can have the staggered nucleic acid test according to the appointment schedule. By doing that, we can avoid excessive gathering of the people. At the same time, we also have to create a more convenient environment for people to go through the test. For the testing agencies, we have to ask them to closely follow the procedure from every step. For example, the collection of the sample and also for the running of the tests, so that those test results could be very quick and also precise. Today we have invited speakers from the different authorities to come to our press conference to deliver relevant information and policies about the COVID-19 prevention and control. So I'd like to introduce the speakers present today. Deputy DG of the Committee of Housing and Urban Rural Development of Beijing, Ding Sheng. Deputy DG of the Beijing CDC, Pang Xinhuo. Experts from the expert team of the National Health Commission and Chief Physician of the Beijing You'an Hospital, Li Suying. Now I'd like to give the floor to Mr. Ding Sheng, the Deputy DG of the Committee of the Housing and Urban Rural Development of Beijing, to talk about prevention and control measures in the construction fields in Beijing. Friends of the media, good afternoon. According to the work arrangement of the municipal government and relevant authorities, we have applied the screening efforts of the construction workers. We have also asked the collaboration from relevant authorities. Since the 11th of June, we have published 3 announcements. On the basis of the comprehensive screening, we have made the nucleic acid tests on key populations. For all the people that should be tested, we gave them the tests. We have also published 2 city-level announcements, so that for the Mentogo project and Huaixing commercial projects from Fengtai district, we have the settlement. As of 24 o'clock, the 21st of June, we have run the test and the screening for more than 700 people. There are more than 800 people that have had contact with people working in the Xinfadi market. All of them have completed a nucleic acid test. Until now, we have discovered 3 confirmed cases covering 2 major construction areas. We have asked the local authorities to take relevant measures and also close down the relevant places of the construction. According to the local prevention and control status, we have elaborated the working plan to tighten our measures. First of all, to continue with the accountability system, we have the 3 measures. Once discovered, we have to follow the due procedures. We have to be very careful in the settlement of the cases. For those people that should be tested, they should have the ability to go through the test. Secondly, we should apply the precise measures on the prevention and control of the construction fields. We have to keep a close eye on the people that have had a close contact with the persons working in the Xinfadi wholesale market. For the vehicles visiting the construction fields, they will be checked and tested. And for people having the symptoms like the high fever, they are forbidden to the construction fields. And for the indoor areas, we have the regular measures of disinfection and also the ventilation. We will also run the tests on the food on a daily basis. And third, the screening measures on the key population groups. Once again, we have addressed the importance of the tests on all the people according to the requirements. For the people that have visited the Xinfadi wholesale market since the 31st of May, we have to include all of them into the nucleic acid test and also expand the possible coverage of the other tests. For the other people responsible for the daily procurement and for the daily management of the workplace, we should keep a close eye on them on a daily basis. And also for the epidemiological survey, for people diagnosed as a COVID-19 patient, they have to collaborate with the authorities and report their trajectory over the past period so that we can conclude all the possible cases inside our epidemiological survey. For the recent confirmed cases in the construction fields, and based on the characteristics of those construction fields with the high density of the people, according to the requirements of the Beijing workforce for the COVID-19 response, we have to shoulder our responsibility and tighten the measures for the prevention and control so that we can better manage the situation within the construction fields. Thank you, Mr. Ding Sheng, Deputy DG of the Committee of Housing and Urban Rural Development of Beijing. Now I'd like to give the floor to Madam Pang Xinhuo, Deputy DG of the Beijing CDC. She will give us the latest development of COVID-19 and epidemiological survey. Friends of the media, good afternoon. Now I'd like to talk about the newly added confirmed cases and their information. From 0 to 24 o'clock, June the 21st, we have 9 newly added confirmed cases, among which 3 male cases, 6 female cases. Average age 48 years old. Youngest is 35 and oldest is 68. All of them are registered in other provinces. 5 from Fengcai, 2 from Haijian, 1 from Xicheng, and 1 from Chaoyang District. We have completed the epidemiological survey for 7 cases and 2 other cases in process. Currently, I will give you the basic detailed information. Case 1, female, 35 years old, from Hebei, living in Huaxiang Township and working in Xinfadi Wholesale Market. Every day, she traveled from between home and Xinfadi Wholesale Market. After the close-down measures of the Xinfadi Wholesale Market, she's obliged to leave the market, and then she's being transferred to the medical observation point. On the 13th and the 14th, the patient has received dinners and meals at doorways by the workpersons in the medical observation center. She received no other contacts from the family. And then on the 19th, she developed symptoms of the fever, later transferred to the hospital in the Fengcai Hospital. She's been confirmed on the 21st. Case 2, female, 49 years old, from Jiangxi. She lived in Huaxiang Township. She worked for Xinfadi Wholesale Market. Every day, she visited Xinfadi Wholesale Market from her house. From the 11th of June, she stayed at home for the quarantine. On the afternoon of the 12th of June, she's been moved to another quarantine site. On the 20th, she developed some symptoms. With an ambulance of 120, she's been transferred to a hospital in Fengcai and diagnosed on the 21st. Case 3, 48 years old, from Hebei, male case. He lives in the Xinfadi Wholesale Market workers' residence, and he works for the Xinfadi Wholesale Market. Every day, he visits the Xinfadi Wholesale Market. After the close-down measures, he started the home-based quarantine. Between the 15th and the 18th, he never left the house. And community workers delivered food to his doorsteps. On the 18th, he developed symptoms of the coughs. On the 21st, diagnosed as COVID-19 patient. Number 4, a female case, 68 years old, living in Fengcai. On the 8th of June, she visited Xinfadi Wholesale Market for purchasing activities, and later she visited the Carrefour and other markets in Sanlihe and Baiwanzhuang for shopping. On the 12th, she visited Wanrenfengjing residential community where lives her daughter, and later she visited another place to sell the wastes. Upon the cluster of the Xinfadi Wholesale Market, she informed the local authority about her case, and she stayed at home for quarantine. On the 16th, her husband has been tested positive, and she herself has been moved to the concentrated medical observation point. And on the 17th, she ran a nucleic acid test and later confirmed as a COVID-19 case with the positive nucleic acid test. and later she's been moved to D10 hospital and diagnosed yesterday. Number 5, female, 47 years old from Hebei. She lives in Haijian district, working for Tiankelong Hospital, supermarket. On the 20th of June, she visited one residential community. On the 7th, she visited Yongding Road. She didn't enter into the community. And later, across the road, she visited one convenience shop for the shopping of vegetables and fruits. On the 18th and 19th, she didn't make any outbound visits. And the following day, she visited the fever clinic. Case number 6, male from Hebei. He lives in Haidian district. It's the husband of case number 5. During the 6th and 11th of June, he's visited the Jingshou market. On the 15th of June, he's been tested negative for the nucleic acid test, and then he stayed home without any outbound visit. On the 16th, he went out for the delivery to a commercial building. On the 17th, he went out for the delivery, and also on the 18th. On the 19th, he didn't report any outbound visit. On the 20th, he went to the hospital with her wife and later diagnosed on the 21st. Case number 7, female from Jiangxi province. Together, she lives with another 5 vendors of the Xinfadi wholesale market. She mainly stayed at the residence. On the 15th of June, she developed symptoms. On the 16th, she's been transferred to the concentration point, and the following day, transferred to Fengtai Hospital in the fever clinic. On the 21st, confirmed as a COVID-19 case. And now I'd like to add up 5 more cases confirmed on the 20th. Case 1 from Beijing, lived in Youanmen in Beijing. On the 11th of June, she visited Xinfadi wholesale market for shopping. On the 8th, 9th, 10th, she visited a massage center, and she also visited Youanmen market. On the 14th, she went to Guodomei supermarket for shopping. She's been wearing a mask. On the 14th, in the afternoon, she developed symptoms. In the evening, she went to the emergency department of the hospital. She's been wearing N95 mask. And all the medics receiving the patient were wearing correct protective clothing. Starting by the evening, she's been quarantined at the hospital and confirmed on the 20th. Second case, female from Shandong, 55 years old, living in Daxing district, Qingying township. On the 20th, she's one of the close contacts of the confirmed case from the 20th of June. She works in the greenhouse. On the 15th of June, in the daytime, she worked in the greenhouse. In the evening, she went to the supermarket in her village for shopping, and later she didn't go out. Between the 16th and the 17th, she continued to work in the greenhouse. On the 18th, she felt that the appetite is dropping, and later she continued to work in a greenhouse, and later she got to know that her daughter has been tested positive for nucleic acid test, and she herself was transferred to a hospital in Dashing district. Case 3, 45 years old from Heilongjiang province, working in Fengtai district and living in the same district. She works for a hotel. On the 10th of June, she went to a convenience shop near her workplace, and later she has participated in a throat swab test and tested positive. Case 4, male from Beijing. He lives in Beijing Haidian district. He works for a scientific investment company every day. He travels between home and workplace. On the 6th of June, he went to Zhuzong building. On the 7th, he visited Yansha outlet for shopping. On the 14th of June, he went to a 4S shop for the maintenance of his vehicle, which is located in Desheng Menwai. On the 18th, he developed symptoms. On the 19th, he drove to the hospital, and later he stayed home for quarantine. On the 20th, he's been transported to the hospital in Haidian district by ambulance. Number 5, 39 years old, a female from Beijing, living in Fengtai district, Changxingdian Road. On the 5th and between the 8th of 12th, she lived in Fengtai district, and later, due to the outbreak of the cluster in Beijing, her work has been suspended and she no longer visited the workplace. And on the 16th, she went back to her original residence and she visited the square nearby, and she didn't talk with anybody. And later she picked up her package delivered near her house, and she also visited a nearby supermarket for shopping. On the 18th, she didn't go out. On the 19th, she has visited the fever clinic of a hospital in Fengtai. On the 20th, diagnosed and confirmed. All those confirmed cases have been transferred to designated hospitals for further treatment. Here, a notice for all the citizens: when you go out, please wear a mask and also sanitize your hands. After touching the goods in the public places, please do not forget to sanitize your hands and always wash your hands after getting home. Please keep the social distancing. In the public places, please wear a mask correctly and also respect your distance with the others. Sanitize your hands and wash your hands very often. Everyone should be taking his or her responsibility. That is end for the daily briefing. Thank you, Madam Pang Xinhuo, Deputy DG of the Beijing CDC. And now I'd like to give the floor to our journalists. The floor is open for the questions. Please first identify yourself. Good afternoon. I'm from Beijing Radio. I have a question for Madam Li Suying. During this epidemic period, what is the focus of attention for the hospitals, and what are the measures to prevent and control the nosocomial infections? The nosocomial infection control is closely connected with the quality of medical services, especially with an outbreak of nosocomial cases. It can directly impact the patients and also the health of the medics as well as their life. After the outbreak of this cluster in Beijing, the hospitals in Beijing have taken the prevention and control of the nosocomial infections as one of our top priorities. We have to apply the accountability system and be very strict with our daily measures. We know that the medics are the guardians of safety and health of all the citizens, and also they are the pioneers fighting on the front line against the virus. Once there is nosocomial infection, then this will distract the major workforce against the virus, and this will also raise the fears in the society and thus reducing the effects of our efforts against the epidemic. If there is massive nosocomial infection in the hospitals, then all the patients in the same ward or in the same department will be put into quarantine, and in the worst scenario, the whole hospital would be locked down. So, in the recent period, we have attached great importance to the prevention of this nosocomial infections. By doing that, we could offer a very safe environment for patients to pursue their medical care and also for the medics to work. This is a way to protect the patients and also the medics. This is also an effective way to avoid the cross-infections among the patients living in the hospital. To obtain those objectives, we have already many measures in place. On the one hand, the hospitals have applied multiple measures to spread the information about the diseases. Not only the medics, but also the patients and their family members in a company will all receive relevant key information. And in recent days, all the visitors to the hospitals should wear a mask. For the fever patients that have already visited high-risk areas should go directly to the fever department, and they should inform the authority about their recent trajectories. When they are waiting for their registration and waiting for the delivery of the drugs, they should keep the social distancing. For the patients, we have also applied the care upon appointment. They have to come to the hospital in a staggered manner. This is to avoid excessive gathering of the patients in the hospital. For the possible confirmed cases, we will first run a screening. For those that have already visited the hospitals, they must know what I'm talking about. For all the visitors to the hospitals, they will get their temperatures checked at the entry. Before entering into the main building, they have to show and scan their health code. They will register their information and also that of their family members in company. Before going into the cabins of the doctors, they will be asked about their epidemiological information. For example, have you ever visited a medium to high-risk area recently? We have this whole bunch of measures that seem quite complicated to all the visitors, but they are indeed very essential measures. We hope that all the visitors and patients coming to the hospital could show enough collaboration, because no one would like to get infected with the COVID-19 virus. We have to do all we can to guarantee the safety of every person coming into this environment, and also other necessary tests, including the nucleic acid test, and also the CT image of the lung area will be in place. We also have the transitional ward for the suspected cases and quarantine areas. After the screening, the patients could be further transferred to the according department for further treatment. For the hospitalization of the patients, there's also a procedure. For example, for the family members to accompany the patients hospitalized, they should also follow a due procedure. For the medics, they also have to follow the rules of the hospitals. For the doctors, they will be held accountable for the first acceptance of the patients. They have to respect the rules of the procedures. They have to sanitize often their hands, and every day they should report their personal status, whether they feel very comfortable, whether they feel healthy enough, whether they have other symptoms. They should report all the symptoms to the authorities, and they should not have a free visit to other departments in the hospital. We also give a delivery of food to the doctors. We also suggest a staggered schedule for the meal taking. The medics should also keep the social distancing while having their meals. And according to the possible risk level, the medics should choose the protective clothing and other appliances accordingly. Moving forward, the hospitals will continue to take tightened measures, and we will keep a close eye on the other non-typical patients and those patients that have developed no symptoms already. If we can follow all the procedures in place, then we can play a very effective role in preventing the nosocomial cases. Next question, please. I'm from Beijing Transport Radio. I have a question. In order to curb the further spread of the COVID-19, what can ordinary people do on a daily basis? I'd like to give the floor again to Madam Li Suying, the Chief Physician from Beijing Youan Hospital. Thank you for your question. In order to further contain the spreading of the virus and protect Beijing and win the battle, every citizen in this capital city should shoulder his or her responsibility. Together, we have to join our hands to protect our town and our city. We have to make daily efforts. On a daily basis, we have to prevent going to places with a high concentration of people. We have to avoid excessive gathering of people, stay at home as often as possible. If you do have a need to go out, especially when you need to go to an indoor area, please wear a mask. Like when you are taking a bus or an elevator, or you are visiting a supermarket or a hospital, especially the underground supermarket where the ventilation is in doubt, you have to put on your mask. After touching the facilities in the public places, for example, the elevator buttons, also the flushing buttons in the public toilet, and the other facilities in the public places, please wash your hands with flowing water or with alcohol wipes. When you go out, you can have some alcohol wipes with you so that you can sanitize often your hands. We also would like to suggest a staggered dining system. And if you eat with the others, please use a spare chopstick. When you return to your house, when you take off your clothes, please turn the side of your clothes and get the dirty side of your clothes towards the inside. And later, don't forget to wash your hands. We have to develop very good hygiene habits. All those would help us to prevent the infection and contamination of the virus. During this epidemic period, we also would like to invite all the citizens to keep a close eye on their personal health status. If you feel not so comfortable and develop any possible symptoms, please go to the authority and the healthcare institutions. Please do not take drugs by yourselves. And when you go to see a doctor, please inform the doctors about the trajectory and other possible infectious disease. This will not only help yourself, but also help to protect the others, including the medics and the family members. Thank you. That is all for today's press conference. This press conference will be available online and also in the other platforms. For example, the Xinjiang Journal, Beijing Youth Newspaper, Beijing People's Net, Beijing Evening News, Xinhua News Agency platform, Xinhua News application, CCTV News application, China Daily app, and the other channels. Our press conference is also available with the radio and the TV channels. For example, the Beijing News. Thank you for your attention, and also thank you all the speakers. That is all for today's press conference. Thank you.